Welcome back. We are here this afternoon with our keynote with Ms. Jody Ann Burry. Our keynote for this afternoon is going to be speaking on our individual accountability and taking us forward in the track for day one in our conference theme of cultural agility. So we're going to have a fireside chat, and joining us is Ms. Jody Ann Burry here. Jody Ann Burry is a speaker, writer, and creator who works at the intersection of race, culture, and health. Born in Jamaica, raised in New York City, and well-traveled globally, her influences transcends boundaries. She draws from education, global health, entrepreneurship, and other disciplines in her work, with always communities of color at the center. Whether she's interrogating authenticity at work or exploring systemic bias as the root of imposter syndrome, her critical lens focuses on how things come to be by examining the systems of oppression that construct the choices we make and how we see the world. As an alum of Boston College and the University of Michigan, Ms. Burry leads conversations with prominent community and business leaders with a goal to not just share ideas, but also leverage the power we already have to address inequities all around us. Jody Ann, thank you for being here today.
Oh my gosh, thank you so much for having me, Sunny.
You know, you've had some incredible conversations, so thank you for bringing us into the fold so that we might claim as well that we are part of the conversation that you're having with Vice President Kamala Harris, with U.S. Senator Cory Booker. Please share with us, your experiences of how you came to be in workplace diversity.
Yeah, so it's something that I think has always been a part of my academic and professional rearing, right?
Mhm.
When you have this consistent experience of being the only one of the few, being different, you're always interrogating, okay, who am I and who am I in this environment? And
Mm,
why is who I am in this environment different than other environments? And you start seeing not just yourself, but you have to also see what's happening around you. And so that's always kind of been a part of my personal experience. And then I've translated that in many different ways in my academic career as well as in my professional career. But I really started to take the issue of like workplace diversity as itself a discipline, right? And I want to emphasize that because I think that in a lot of different ways, if you're professional today, you should be doing what we're calling workplace diversity, right? Just in the function of your work, right? If diversity is not at the center of your work, then what actually are you doing, right? If you're a care provider, but you're not providing that same level of care for people who are demographically different than you, then there's something, amiss here. So I think I
mm,
started taking that actual like discipline of workplace diversity very seriously as its own thing separate from my actual job when I was working in global health. And so I did global health for about 5 years. Most of my work, even though I lived in Seattle, most of my projects were in sub-Saharan Africa,
mm.
Malawi specifically. And what's interesting about the global health industry, about international development as a sector, is that it is grounded in colonialism, right?
Mm.
But there is no working definition or ability to talk about that history within the global health or international development space, right?
Wow.
It is very rare to be in these spaces where people can even talk about racism, right?
Mm,
And it is the foundation of this profession. And so, being the Black person on the Western side of the house, because global health and international development organizations are typically geographically dispersed. They have a headquarters that's either in the US, Canada, or some European country. And the greater majority of the people who work at this one organization are actually located and living in Africa, in Black and Brown countries all over the world. And that's the
mhm,
typical dynamic in this industry. But we can't talk about racism, right? And so being the Black person on the Seattle side of the house, it was this interesting straddling of, I see what's happening in Seattle, and I have a different lens of how I see what's happening in my international offices. And so I became that bridge to say,
Wow.
hey, because I'm facing racism in these places, right? And so, how can we actually not just talk about this dynamic, but build it into how we do our work? And so, through that process of kind of like, I don't think this is right, right? Mind you, I had no standing in my organization to be doing this. In my department, I was at the lowest like ranking, right?
Wow.
But this is me to the president. Can we talk about the lack of racial and cultural diversity in our headquarters? Like, I'm the
Mhm.
only one here, you know? What is that dynamic between our office and our international offices? And that one question, right, led to a working group with our organizational leadership to not just say, oh, we care about diversity, but let's break this down and
Mm.
let these values actually impact our work. I'd be happy to kind of give an example of what that looks like.
Please, please.
Oh, for sure. Okay. So, you know, oftentimes
Mm.
organizations, and I think there's some defensiveness of like, we do good work, and this is especially in helping professions, right?
Mhm.
So, not typically companies that like make widgets, for example, but if you're in a profession that helps people and helps vulnerable people, I find that because that's such a big part of your identity, I'm a good person and I do good things for people who need help. It is a harder message to say, hey, some of that work that you're doing and how you're doing it is harming people, right?
Mm.
Because of your own blind spots when it comes to race, sex, sexuality, what have you. And so that was a bridge to cross as well of like, wait, we do good people. We do good work, right? In sub-Saharan Africa, like how could we be racist? And so not even starting at that conversation, but to say, hey, if that is true, right? If you are a good person who does good work and you're not racist or our processes aren't racist, let's evidence that, right? And the evidence for that wasn't there in black and white, right? So
Mhm.
we broke down, let's just start four kind of areas of our organization: our external communications, how we talk about our work, human resources. We had this section called like internal communication. So, how do we talk to each other and what our norms are within our office and to our international
Mm.
offices? And what do we know, right, as an organization? What's our collective knowledge and how do we build our learning and professional development and even just the knowledge of these topics? And so we kind of broke that down. So I'll give you an example of external communications. And so
Mhm.
we started with, as an organization, and I'm just making words up here, diversity is important. Great. But what does that mean for external communications? So we set up guiding principles for our particular department to let that one sentence value statement have some teeth, like in the work that this department does. And
Mhm.
so part of that guiding principles is to recognize the existence of poverty porn, that there is a history of showing people of color in vulnerable communities around the world in these very kind of dire states that doesn't
Mhm.
show them with a level of standing and dignity, right? Just because you're poor, right? Or just because you need health care doesn't mean that you have lost your dignity. And there is a history in this industry to show people that way, right? We see these people in this community as partners and as stakeholders, and we have to represent them accordingly. And so that was the principle. And so if that is true, if that truly is the principle that guides our work in communications, we do images and words. Like, keep it really simple. So what does our photography look like? Right? And we set up all, this is what a good photo is. You know,
Mhm.
here are some of the things that you want to think about when you're taking a photo and really skill people up of
Wow.
this type of angle empowers someone in the image, right? If you shoot
Mhm.
someone bottom up, they're powerful. When you shoot someone top down, it's like you're standing over them. And
Mhm.
to that level of detail, to think about what does a photo communicate? And so based on those guidelines, we audited our entire photo stock, right?
Wow. Wow.
And years of photos. And and deleted the ones that should no longer be used based on these guidelines. We did the same things with words, right? What's the language that we want to use to communicate our work? And so someone found in a blog, for example, she was one of my coworkers, a white woman in Seattle, was talking about a mother in Malawi and like kind of her struggles of trying to support her children. And so
Mhm.
for her, she's connecting with her as like we're both mothers, right? And but the language that she used is like, even though she was a world away, we were still blah blah blah. But it's like she's not a world away. She's not an alien, you know? Is one flight could take you there. It's just an ocean. And so how do we, even something like that, where we try to create so much distance between people who are
Mhm.
different than us, even with the intention of showing that alignment, we don't have to use that language that kind of dips into these people are so different, so foreign that we don't even share the same planet, right? And so once we did those audits, then we had a good sense of how we want to develop new content. And so
Mhm.
part of that is to build in like a sensitivity review on
Mm.
our collateral. And
Mm.
again, not everything needed like a heavy hand. And we decided to disaggregate all of our collateral in three different levels based on how much it costs to produce and how easy it would be to change. And so if something's digital, it'll probably get a lower read, right? If something's printed but in small batches, or it's like a two-pager, or something that is like intensely invested in, like a very high investment collateral, all have different levels of like a
Mm.
sensitivity review. And then what we also needed is a complaint process, because let's just say something gets missed in that whole process. It can't just be, which is what it was before, Jody Ann doesn't like this. And so we have to change it, or we're going to find someone at a higher level than Jody Ann who will override it. But
Mm.
now it's like, um, based on our principles, we don't do this anymore. And so I saw something in a piece of collateral, and I know that I have this process to change it. Now, all
Wow.
of that was done. It took time, right? This is a nonprofit organization that did this work. We all volunteered a portion of our time to really
Mm.
get our heads together to get this going. And most of the people who worked on this, like external communications flow, were people already in the communications department, right? And so, to my earlier point, this is the work that you do. So, how can we build this into the work that you do, right? And not see it as this add on, but if you're not doing your work this way, right? With diversity and sensitivity and inclusion and equity at the core, then what are we producing? Right. And so I think in going through that process at this organization, it showed me that this like diversity and inclusion is not unattainable, right? It's so valuable to actually help our organizations and our companies function better, help our work be better, and the impact that we want to have, particularly for those of us in helping professions, that we can get closer to this intended impact because we're not stumbling as much and
Mm.
dipping into these pitfalls of a way to do work that doesn't have diversity at its core. And so after that experience, it gave me the assurance to say, oh, okay, I can help do this at other organizations. I can help apply this work in other dimensions of diversity, right? To really look at this is not scary. It's super doable, and it can be done in a very collaborative and impactful way and sustaining way. So that work that we did, this was years ago, it still continues at this organization, and I haven't worked there in years, 5 years, and they're still doing this work.
I think it's phenomenal. You gave us just this fantastic verbal toolkit of tactical diversity steps. I'm literally taking notes down, going, okay, I know what the questions are going to be. They're going to be, do you have a slide? Do we have those checklist points? And I will say to the audience, yes, we will get that checklist of points out. So external comms, HR, internal comms, language, right? Guiding principles, doing literally a diversity audit of images and words, and like getting photography processes, changing this to be very, we all agree, these are the principles, this is the audit, these are the guidelines. It doesn't require approval because it's already check and balanced. Is it or isn't it? And I love this context of how you frame this of, yes, we do good work, but it's important in how we do this good work and how we're providing these standards and prioritizing what we change and what we are transforming within our own workplace cultures. You have this great comment about this sensitivity review. Can you delve a little bit more about like, how was that created? Was it super subjective, or was there, very clear checklist points? Just kind of guide us about this sensitivity review.
Yeah, so typically, sensitivity review happens with someone who is either part of these communities, vulnerable communities, or communities that have been marginalized, or people who are like deep in that world. Even that's if that's not your identity, you have
Mm,
enough of like common stereotypes and kind of the cultural things where you use that perspective to review a document, let's just say. And so if I'm evaluating images, not only as a Black person, a Black woman living with disabilities, a Black woman who's living with disabilities, who's an immigrant, um, and someone who is all of that plus a photographer and studied communications, right? If I'm gonna kind of flip through, some documents and examine images or words, I have a more refined sense of it, right? I have a
absolutely.
higher like sensitivity to these things because I have more exposure to these things, right? Now the challenge with that is you don't want, your one person of color, pick
Right.
the race and ethnicity who's in your office and it's just like, hey Stacy, can you read this? Stacy, can you read this? And it's just like Stacy has her own work to do, right?
Yes. Yes. Thank you.
So so it can kind of dip if you start um, using your colleagues for to be sensitivity reviewers
Mhm.
without their express consent or without compensating them for
Mm,
that.
mhm,
And there are plenty of people who can do that. Now, because of that dynamic, what we did in that process in like our photography guidelines
mhm,
is I outlined, and God help me if I can remember it, but just kind of five principles when you want to think about like photography, right?
mhm,
So one principle of it is like, who are the doers,
mm,
right? And who are the receivers of an action. So typically in development photography, you often see the doer, the person who is doing the acting in an image, right? Giving out medicine or talking to someone else. Disproportionately, you will see that to be a man,
mm,
or you will see that to be a white person.
mhm,
um, Maybe a white man. There are a lot of white women who are in these types of spaces, and they are the doers. So they actually hold the power in the image.
mm,
And then you'll have, the Malawian, the Liberian person who's in the image who is receiving that action.
mhm,
And so that even just outlining, like, okay, let's think about power, right? Let's think about context. Oftentimes, in this world, and I'm sure you can apply it for people on the call into your own space, is you'll
mhm.
see an isolated image of a woman and a child walking.
Yes. Yeah.
But it's like, where is she? Right? So if you remove the crop of that image, she's actually walking to a health center. And so now we've located her, right? She's just not like just walking randomly with some child, and then you get to use her image however you want. You could talk about her in any type of way. But if you put her where she actually is, which is near a health center, then you have to talk about her in that dynamic. And so what we did is just say, let's think of these kind of categories, right? What is the context? Who are the doers? Who are the receivers of the action? And that would help skill up other people who don't have the same background as me to be
Mm-hmm.
able to notice those things as well. And so the photography guidelines, and I think in any type of work like this, it's professional development, right?
Yes,
So
yes.
it's not enough to say, it matters to me to represent our constituents and our stakeholders in a dignified way. But how, right? And especially with organizations where the people who are putting these things together are so dispersed,
Mm-hmm.
right? We have all types of people who get to take photos of our work. We have all types of people within our organization who are putting together these collateral. And so let's have something that helps people, right? It's not some bureaucratic thing or whatever, but it's like, yeah, I want to select the best photos. I want to have a good sense of how we should be talking about our work that is not only compelling, right? Not only impactful, but shows how we say we care about the people that we work with and partner with across the world. And so this is to help us, right? And so I I think there is value in sensitivity readers, but I think anyone can skill that up, right? And I remember having a back and forth with our director of communications, who's like, "Do you know how long it takes to put this collateral together? There's no way we can add another layer to that stuff." And so I remember saying to her, "Don't we review these documents for typos?"
Mm.
Yes, we do. So the same work to review a typo is the same work to review, is this problematic? Are we talking kind of down to or negatively of the people that we partner with in other countries? It's the same process. And so let's just take a different lens, right, to be able to do that work.
I love how you layered a process, a change impact to incorporate more standardized equity knowledge across your organization. That's amazing. I also love this visualization that you're giving us of, hey, when you create a brochure, give justice to the service that you are representing. Don't make it a social commentary about an entire population. And I think that's so important, right? Because we in social services, mental health and addictions, marketing, we kind of try to kind of keep in within our guardrails with Section 508 compliance and what are we trying to share versus what do we do, and then comparing to our other providers' organizational materials, right? And so sometimes I feel like we look at a brochure, is it telling our patients or our proposed patients what are the actual services that we offer in clear speak? What is inpatient services? What is
Yes.
outpatient services? What is the stuff, right,
Yes.
that we are actually providing? And how can we clearly say, this is what you can expect when you as a patient show up? And then in our HR guidance and training and materials, this is what you can expect when you as, the intake, the case management, the clinician, et cetera, when you show up, this is what you can expect from your fellow coworkers and your peers and so forth. So thank you
Yeah.
for visualizing that for us because that's so important.
Yeah, and a few things I'll add here too. I remember one of the principles I called like replacement, right?
Yes.
Like if the person in this image or the person who is being talked about was you, your child, someone that
Mm,
you love and care about, would you want them represented that way? Right? And there's this dynamic oftentimes in service provision, and especially if you have the ability to get funding and grants for those services, that you put like the images and talk about people that you want to pull at their heartstrings.
absolutely.
But it's like,
Absolutely.
would you want your child's entire bare bottom on the cover
Mhm,
of like a grant proposal? No, right?
mhm,
And it's interesting as you talk about like these patient materials. I remember when I was in grad school, there was some study that we read where they had different versions of like a diabetes patient information brochure.
mhm, mhm,
And one version of it just kind of talked about diabetes and the medications and just gave more context of like diabetes itself. And the other one also had information about how um, diabetes is disproportionately high in the African American community, and really talked about a lot of the health inequities of diabetes in that patient brochure, in addition to information about diabetes. And what I recall from that study, which is something that really impacted me, is that the knowledge of the health inequities had a negative impact on patients' compliance with
mhm.
like taking their medication. That the information itself could impact someone's behavior
Wow.
of knowing about those inequities. And so, when you're, as me, and I'm sure, and for yourself and many people on this call, when you are part of these targeted communities,
Mhm, mhm,
I think that's also important when we talk about health inequities, how that gets specifically messaged, because it can be really hurtful and damaging to be talked about in these ways around the statistics, um, and it can be a little like defeatist. Like, yeah, why would I take my medication if you're telling me that by the very nature of me being Black, I'm going to have a high rate of diabetes, which is not how that happens, right? Like,
right.
the fact that there's a disproportionality of disease in some communities maps onto so much more, right? Than there's some genetic disposition in particular races that gives you high diabetes. That's not the case. That's not how that works. So,
Yeah, there's this commentary here about the appropriateness of sharing information. And so many times when we are providers, very much in a conference setting like today, where we are being given population level information, is that appropriate to share on an individual one-to-one patient experience? I mean, Jody Ann, if you were my clinician, you were like, Sunny, Chinese people broadly, da 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 da. And I was like, I'm not sure how that applies to me, but okay, thanks for that. It begins shutting down my let me explain myself. And now I'm burdened with how do I begin the conversation about me when the burden of the statistics of the entire population has now been shared,
yes. And now
right?
it makes me feel like you see me as a population data
Yes,
point
yes,
and not
yes.
your patients.
Exactly. Exactly. I think that's so key. And thank you for giving us that again, that visual of how data is important, but data also needs to be shared in the appropriate context. We're incredibly data driven in the kind of diversity, cultural competency, overall learnings and trainings that we're working on. I want to take a moment and kind of delve really into that public health space. You pretty much are like Ms. Public Health. So going from Boston College to the University of Michigan for a master's degree in health behavior and health education, I just have to nerd out for just a moment because we also have very standardized how we share information and education. So we're always very focused about policy review, frameworks, the actual case studies, the data sets, and then ultimately a call to action of how you do it within your own organization. So yes, I have to ask this question. The audience is going to groan. What is your favorite framework in public health, ma'am?
Okay, I've used this in all types of ways. You have like off-label usage of medications. I have some off-label usage of this framework, but I love the social ecological model.
Hmm.
It is it stays with me. I have recreated all those circles that kind of connect to
Wow.
each other. And it's so critical to understand that, like, what is this dynamic interplay of the individual level, the interpersonal levels, organizational, community, and public policy, and how they all connect. I think and I know we're talking about individual responsibility here, and that clearly has a pathway of, like, your attitudes, your beliefs, your behaviors could, yes, impact how you relate to other people, how, organizations operate, how they connect with each other, and public policy. But sometimes I think we over index on that direction of it. And even in when you were reading my bio, I heard the social ecological model in there, where I talk about, like, constructing the choices that we make,
Mm,
because we have the policy level, the community level, the organizational level in how we relate to other people, that also influences our attitudes, our beliefs, and our behaviors,
mm,
right? And so I I I would love to see how all of that intermixes, because sometimes I think we feel like we're just making our own choices without realizing that those choices were constructed, right, by this larger model that we're in. But what I really like about it in a health context is you can't always pinpoint an individual cause, right? Even we're talking about diabetes, right? Like, oh, well, this is your own personal decisions about how you eat. And I'm like, well, let's talk about public policy about, how we subsidize the corn industry, right? Like, what foods are available in what neighborhoods, right? So
mhm,
the choices that I individually make about my food are also constructed at so many different levels that gets me access to that food, right? And so there's so many different causes, but what's also really exciting is that we need a dynamic, multi-dimensional interplay of solutions, right? So we need public policy. We need people to, skill up and shift their attitudes, their beliefs, and their behaviors. Who's around them to support them with that? What access to different institutions and organizations and all of that, right? And that kind of that dynamism, just like, it excites me so much. And so I think about the social ecological model when it comes to health. And I also think about it when it comes to workplace diversity issues,
yes.
right? And so, yes, for me, in the what I shared at the top of this conversation, my attitude, my belief, and my behaviors did get to shift a lot of what was going on in the organization. But as a result of those new policies and the ways that the organization worked, that will influence new people coming into the organization and their attitudes and their beliefs and their behaviors, because there's a different environmental context that they're walking into than I walked into.
Wow. Wow. Let me just repeat this. Dynamic, integrated social interplay of decisions.
I mean, that sounds good to me. No.
Okay. Okay. Dynamic, integrated social interplay of decisions, and how that comes together to allow new conversations, which is really the catalyst of what you're doing, right? And then how that helps to frame the social ecological framework.
Yeah.
So I feel like your podcast, Black Cancer, is like that living, breathing, continuous evolution. Can you share with us more about the genesis of the podcast, Black Cancer?
Yeah, so 4 years ago, I had a spinal tumor diagnosis, had the surgery for that, and I love podcasts, like, love, love, love podcasts. And I couldn't really find a podcast that was about cancer, that also had people of color in it, right? And so
Wow.
I needed both. I think there are one or two podcasts that I started listening to, and there was just such a almost like an irreverence, the way that people were just kind of talking about their cancer experience, that I really appreciated. Like, they're cracking jokes, and they have different guests on who have different types of cancers. The woman who hosted it had terminal breast cancer, and actually, I was diagnosed in March, and she died in 2018. She had died later that year. And so there was just this like openness to talk about something that I feel like when you talk to people who have not experienced cancer personally or with someone that they love,
Mhm.
they're kind of scared of it. Like cancer is the thing that we are socialized to be scared of and to avoid at all costs, right? Don't eat too
Mhm.
much of this, don't do that, you're going to get cancer, you're going to get cancer. So then what happens when that actually pops up in your body? So I
Right.
didn't have a lot of outlets to talk about it, and I needed um, that kind of intersections of I want to talk about health, I want to talk about cancer, and I want it to be centered among people of color. And so I just created it. I created it myself. In my experience, I had like a post surgery depression, and it's just a very isolating experience. And I found
Yeah.
that I only felt better when I talked to other people who were kind of miserable about cancer.
Belonging, therapeutic belonging. Yes.
I need I needed to find a place to belong. And so I made the podcast, but I will say this, the podcast almost didn't happen. You
Oh.
know, I had the idea for it. I had all these people I wanted to talk to about it, for guests on the show. And um I just felt so like very overwhelmed by the project, right?
Mhm.
And then in the midst of the 2020 racial uprisings and protests that were happening all over the country and all over the world in support of the movement for Black lives, the health community had hosted, there was in Seattle, I believe that there was some across the country, white coats for Black lives demonstrations or protests, right?
Yes.
And so people in the public health community and the medical community, you know, got the white coats, support for Black lives, which sounds great slogan, incredible t-shirt, I am sure. But it enraged me
Oh.
because my question was, where was your white coat for my Black life when
Mhm.
I was trying to get diagnosed for 3 years? 3 years from the time that I first made a complaint about the pain that I was experiencing until when they finally found a tumor in my spinal cord. So where was your where was your white coat for my Black life when I was trying to get diagnosed? And for all the people who are still trying to get diagnosed, and for the disregard of the disproportionate death among people of color from COVID-19, where are the white coats for those Black lives? And so it was not enough for me to see all these images of people and they have their signs and their white coats and they say that they value this thing.
Mhm.
And at the same time, I am not confident that you are not also the people who are downplaying or discounting the amount of pain that your patients of color are facing when they're trying to talk to you about their conditions, right? What about all the mothers, right? And there's a statistic out there, forgive me, I don't have it top of mind, but that Black babies have a higher chance of surviving if if their birthing parent has a Black doctor.
Wow.
So my child's health and and ability to live
Mhm.
is contingent on my doctor's race and trying to carve out some space away from the bias, right? That is critical for me to get good care for my child to be healthy. Where are the white coats for that? And so as much as we talk about these like population level statistics on, you know, vulnerable communities, can we also have that same conversation about the bias that's in the healthcare community? Can we
Yes.
talk about the level of financial toxicity that so much of us are facing and having to choose between our healthcare and our ability to like live and function, right? That in this country you can go completely bankrupt if just you have one medical emergency. You know what I'm saying? So it's like the protest, it hit me like something deep. Like anger and rage, I know how to process those emotions, right? And so as soon as that happened, I'm like, this podcast is happening now. I think the next week, kind of the episodes and work that I had been sitting on were in the world, because I wanted to give space for people to not just talk about, their experiences with the healthcare system, but to talk about themselves through the lens of cancer, through the lens of that journey, and kind of elevate our personhood. So we're not just talked about in these kind of population level statistical breakdowns of what's happening, that Juliet, right? Franz, Yejin, Angelica, and what they went through, and let the texture of their lives and the texture of their stories and the richness of that help inform the decisions that you make as a provider, or what you want to start kind of influencing upstream to change those policies, right? To change those practices. And so someone else who's coming into that space behind you already has a different foundation of how they're going to provide care.
I just want to breathe that in for a moment and for us just to process that, because, to your point of the community that is clinicians, that doesn't mean that only clinicians of color can serve patients of color. It means that where we are today, the shared experience of a clinician of color, being a person of color, puts together an understanding foundationally with a patient of color that is more aligned. But when we look at the intersections of that, right, that all that is making sure that we have the ability to listen and the ability to really show up on a one-to-one and have good, competent, constant conversations to advocate for our patients and really share and show, is this something I'm not getting? Is there a question I haven't asked? Is there something else you want to share? And giving those open-ended opportunities. Because our clinicians of color, they are overly burdened. Just as your
Yes.
example of, Stacy, who's getting all the marketing to be like, you are the sensitivity reviewer for all of our documents.
Yes,
Now we have
yeah,
a clinician of color be like, you get all of
yeah,
the patients of color, and you're just like, what is happening, right?
yeah.
That's not the solution. That's not the
No,
answer. And I, my very paltry but very sincere thanks for you to have had that catalyst of action, so that that podcast is really a treasure of shared experiences from the patient lens that we as providers and clinicians can just go and listen to as a third party with open ears to say, wow, I did not know that.
yeah,
And that is okay that we did not know that, but that we have the heart to go and listen to then know it,
yeah.
because then how we do good work has changed.
Yes, yes. Thank you. That everything you said, absolutely. And I can't tell you, like, I'll give an example. I've had so many conversations with people that even though our like cancers are different, our treatments were different, there's a lot that we connect on. And there are things that I thought were just me, like me being weird, but was also mirrored in their experience in some way. And so I talked to people on the podcast about like the triggers that we have of the trauma of hospitalization. And so
Wow.
even to this day, 4 years later, I walk into my doctor's office and I'm fine, I'm like cracking my little jokes, like everything's good. And then as soon if I have to put on a hospital gown, I shut down and I'm crying. Just just and every time I walk in, I'm like, no, it's not gonna happen. I'm kind of over it. Like everything's good. As soon as the gown comes on, I'm crying. right? When I go to my care providers, they
Mhm.
know this. And normally I try to dress in ways that I don't have to take my clothes off, and they don't push me on it, right? Or they'll like give me a pair of shorts or whatever, like anything to keep me out of a gown. If I go to a new care provider, it's almost like I have to fight for the ability to just keep my
Mhm.
clothes on. And that feels so unnecessary, right? I know that I don't need to wear a gown for this exam because I know what this exam is. I know that what you need access to, and I'm trying to dress for that, right? I don't want to be in the gown. And so I've been with some care providers, and it makes me very anxious. Even as someone who has gone through this whole experience, I have my public health degree, like I have a good understanding of this. I get so frustrated and I feel so talked down to when I try to advocate for myself. And I have all the institutional entitlement, to walk into these spaces and like get what I want. And that is not enough to like protect me from feeling invisible. And so going into new doctors is always a very anxious experience for me. Like I like to stay with the doctors that I know so I don't have to have this battle. But for people who are taking in new patients, as you're talking about just kind of listening to them, um
Mhm.
sometimes that's literally it, right? And a lot of my care providers, as we talk about identity and race, are white. And I talk about race and racism so much, like you would not believe what happened to me, Doctor. And I go on, and they listen, and they are in the conversation with me. They're not fighting me on it, and I think they use that information, like the next time I see them, to connect with me in some way, right? Or use that information to like do their own research, their own learning, because I experience them differently the next time I see them. And I think that is so critical because you don't want to create any conditions that you can lose someone in the follow-up process, right? They don't want that happened to me. So I had a
Mhm.
negative interaction. I didn't go to the doctor for over a year. And in that year,
Wow.
the symptoms worsened and I was not seeing any doctor. And then the next appointment I had is when they found the tumor, right? And so this work, particularly as care providers, and understanding stories and getting those nuances and getting the textures of it, it helps skill you up, right? It helps provide better care to people who are different than you. It helps kind of sharpen that, as we're talking about the sensitivity reading, it sharpens your kind of sensitivities, and it sharpens your analysis, and it kind of heightens your spidey senses are tingling, right? Like, I think this person's uncomfortable, or I think here's what I can do to make things easier for them. And that helps you do your job better for everyone, right? And especially people who are different than you are.
I think you have such visceral visuals that you've given to us as you've shared with us these experiences. And I just want to take a moment to the symbol, the literal donning of the gown, right, is a symbol of you having to share that repeated trauma of hospitalization with every single provider.
Yeah.
And you having to be your own voice and having to relive that. And for our mental health and addictions providers, it's for our patients that have to, there's no necessarily a physical body to take the step of checking prior to the appointment, right? The symbolism of the donning of the gown is literally the how do I express my trauma, as where my addiction is a symptom of that in a very first interaction, right?
Yeah.
How do I have that trust and relationship and the ability to open up, and then compound that with all of the additional traumas, the trauma of racism, the
Hmm.
trauma of having to have this conversation for years without getting any support, having to have the resilience as a patient, right, to continue to have that conversation on and on. So our mental health and addictions providers, just again giving voice to that and understanding that when our patients show up, that there's a tremendous amount of additional just stuff that they have
Yeah.
to provide us with.
You know what's interesting about the gown too? You know, as someone, and everyone carries their traumas, and your patients are, as you're saying, they have their own histories in all types of ways. And
Mhm.
so there's, I hope people don't take it on as like, I'm already burnt out. I'm already overworked. Now you want me to learn about all these little things? Like it's too much. Like
Yeah.
I'm sensing that. I don't know why, because I can't see anyone, but it's like I could see that as a response to that. But
Mhm.
I think
Absolutely.
as a Black woman who's kind of gone through very intensive medical experiences, a lot of mental health traumas with that whole dynamic as well. So often I feel like I have to fight for my care providers to see me, right? And not only just the care providers, but just like this, the larger world. Like, can you see me? Can you see Jody Ann?
Mhm.
And that is the fight, that you don't see me as some Black person. You don't see me as some woman. You don't see me as this population level statistic. You don't see me as my diagnosis or whatever is in my chart. Do you see Jody Ann?
Mhm.
And what the gown does, it takes away
Wow.
my individuality. It now I'm a patient, and I think that's why sometimes people even resist getting diagnosed for, mental health conditions, or kind of, you only see me for this condition. Do you see me, Jody Ann? Or do you just see my diagnosis? Right? And the gown, I think, is what is this kind of erasure of self. And I'm sure there's some type of similar, like, kind of triggers, or like a similar dynamic in the work that you all do as well.
Absolutely. Absolutely. I'm reminded of a recent Transformation Change Agency meeting where one of our psychiatric hospital team members said, I want to provide the service and do the work that if I had to have care here, that if I had to refer my family, there would be no question. And she says,
Hmm.
that is the work that I see that we're doing, but there's always room for improvement. And I just went, I lost for words.
Yeah.
Because
Yeah.
if we have organizations that are performing at that level where, irrespective, you and I, we've both read administrative code, right?
Yeah. Yeah.
It is something else. But for people to be creative and innovative and still be able to serve and be phenomenal clinicians and staff and team members to each other, it's incredible. And that's an incredible workplace culture.
Yeah, for sure. For sure. It's the dream.
Well, we've spoken a tremendous amount about just the such the powerful impact of your so many of the voices that you're giving light to, right? Your voice as an employee that led to becoming an influencer, that led to becoming a leader, your voice as a patient, and then an advocate of other patients, as a survivor, and as really a commentator on how the system of care that we're seeing today, how it needs to be transformed on a global health and also on a individual institutional level. Wow, so much. You've talked about, from your lens as a public health expert, how you've created, and given new voice to others through all of these different mediums, from social media to TED Talks to podcasts to your upcoming book. And then your continued innovation in bridging all of these separate disciplines. And yes, yes, amazing frameworks from all these disciplines together. So when you look at all of this and you've given us vision and toolkit and checklist to diversity, can I beg you to also do that for cultural competency? So laying that burden, sorry, at your feet because you did such a
Mhm.
beautiful job of it with diversity, equity, inclusion. What is cultural competency, and how do we, as employees of organizations, as care providers, how do we do it? How do we start? How do we approach it?
Oh my gosh. Yes. Thank you for asking me about cultural competency because, as I said, I worked in global health for a number of years, and
Mhm,
that's a workforce of people who travel all over the world, who speak all types of languages, who work every single day with people who are very different than them, right?
mhm.
Live in different parts of the world. And I'm just like, working in global health, I met the most culturally incompetent people
Ooh,
I've ever worked with, ever, right?
so this is a what not to do. Got it.
And
Okay.
so the competency is not just in exposure, right? But can you understand cultures? Can you have a fluidity of norms, right? Can you allow for multiple norms that your way is not only not the only way, but not always the best way, right? And can you interact with people who have different belief systems, different cultures, different backgrounds than you? And can you do that? Can you do that successfully, right? And at an organizational level, there would be a high level of cultural competency when you don't
Mhm,
see things like Stacy's the only person who could be a sensitivity reviewer, or that having a patient or client provider that requires cultural congruence, right? To be
mhm,
successful, that they have to be the same in order for it to be successful, that you can have culturally incongruent parties, right? Provider to client, and that still there's such a high level of cultural competency that that's okay, right? Because for people who are underrepresented in the profession, right? And then people who are part of communities that have been marginalized, it's not easy, for example, for me as a Black woman to easily find a Black female uh, therapist, for example, that is also in network for my health insurance.
right, right.
So we can create even more inequities if we require cultural congruence without cultural competency. That
Mm,
I should be able to see a provider who is demographically different than I am and still get high quality care, right? And so when you see things and know this is part of your culture here, is to have a process that is through a cultural competency lens. What I would encourage to do is, well, how do I evidence that competency?
yes.
It can't just be that I care about it. It can't just be that I'm exposed to people who are different, right? And it can't even be that, as a that I speak this language,
Mhm.
right? So that makes me culturally competent. No, it just gives you an opportunity to be problematic in more languages, right? But how do you communicate with empathy? How do you listen? What work are you doing? Let's talk about individual accountability here to skill up, to have those textures and nuances of different people's experiences that you can bring that in, right? Into your connection and into your relationships with people, that you don't require your patient or your client to catch you up on kind of what's
Mm,
going on in those communities.
wow. Yes.
And so I have a friend who says this all the time, that, people always want to have dialogues, dialogues, dialogues. But dia means two, right? So you have to bring something to the table. I can't just be the only one who is sharing, and you don't have even a soft place for that information to land,
Wow.
right? or that you can't be in conversation with me about what I'm saying.
Wow.
Dia means two, everyone. You have to bring something to the you have to bring something to the table.
I love that. I love that. But it is, right? It's the simple ahas to say, great, I read this or I listened to this, but
Mhm.
how would I express this in my
Yeah,
own speak? And how, in sharing it, is it actually helpful and not just a curiosity
yeah,
or a um, self validation, that it's actually helpful? And to your point, very simplistically, a part of the conversation where
yeah.
we can offer and proffer additional points.
Yeah. And so I'll give an example for myself, right? I don't identify as queer. I'm not trans. I'm not non-binary, right? And so I have exposure to people who hold those identities. And
Mhm.
I also listen to a lot of podcasts, and I follow a lot of authors and like read their work who are in these communities, right?
Mhm. Mhm.
And so just to like, if I'm going to get my politics, if I'm going to do all these things, like I can get that information through voices that have a different life experience than I do. And so in
Mhm.
the process of all of that, I heard someone talk about like dead naming. And when I say talk about it, they didn't explain it. They just had it in a sentence. And I was like,
Mm.
I have no idea what that means, right?
Mm.
So I Googled it, right? And dead naming is the process of you refer to someone by the name that they used before they transitioned, like their birth name.
Oh, wow.
Yeah. So I have a friend who was born as Ryan. Their name now is Raquel. And so if I kept calling kept calling Raquel Ryan, that's like dead naming, and it's like very it's not only disrespectful, it's bad, right? Like it is not something that you should be doing, and it's also built into our cultures, right? And so it can be really difficult for people who transition to get their IDs changed and all that kind of stuff because they're still kind of still operating with these dead names. And so when I'm in conversation with someone at a friend talking about like dead naming, and I'm like, yep, that's great. Like I get to be in discussion because I've already done my work because I
Mhm.
realized I didn't know something. I skilled myself up, right? And then when I'm talking to my queer friends or my trans friends and they're talking about these things, I have a sense of what they're discussing. I don't
Right.
I don't need them to explain it to me as they're just trying to be in community with me, right? I already have something that I'm bringing to the table. I have a soft place to land for that information so we could just keep our discussion going. And so I would love that is also part of the work of cultural competencies, as I was saying, and as we're talking about individual accountability, that you have to take ownership of your learning process, right?
Mhm.
It's not just being exposed to difference, but having a skill set to engage with that difference in a really meaningful way.
And thank you so much for that. Being my background in technology, when you educated me about what dead naming is, the first thing that I thought of is, oh my goodness, we are perpetuating dead naming without even knowing it because our patient systems don't give us an opportunity to pull two identities into one profile,
Yeah.
right? And it doesn't give us the opportunity to um, have all of that medical history and information honoring Raquel, without Raquel every time having to show up in the symbolism of the gown, right?
Yeah.
Her piece is I have to explain to every provider that I am a trans woman. And then for providers that do not understand what trans woman means, having to explain all of those details to reconcile Ryan and Raquel, who is not who I am today. And I am just shuddering at the fact that that is a system, like our
Yes.
literal systems in
Yes.
technology, right, are creating further systemic inequities. so that anytime a transgender individual shows up as a patient, their first gown is their name.
Yeah. And having that process shows me your level of cultural competency without me ever needing to talk to you, right? That your process itself and my experience in the process demonstrates the cultural competency without you having to tell me, you know what, Jody Ann, I really care about the trans community. I know it. It's on the forms. The fact that I could just like click this box, I need to merge two records, or I have a new name and I'm the same person. Yeah, thank you. That is cultural
Yeah.
competency.
We have learned so much. We have had moments of reflection, have moments of just pause, and um, I'm just humbled in your incredible sharing of experiences, and your just being with us and showcasing all of the different perspectives and roles, and how you've been a key influencer of health equity and cultural competency through really every lens, every role, and just who you are. So I thank you. And I'd like to open it up to questions from the audience from Ms. Jody Ann Burry. And just, I will take a moment to process as I look at the questions and moderate and offer, Jody Ann, if you'd like to share anything else while we give our audience a few minutes to type in their questions.
I'm super excited to be here, and this conversation has been fantastic. Thank you so much for the opportunity to share, and just be in
Thank you.
community with you. And I hope that this will have a sustaining impact and be a catalyst for the folks in the room to build some cultural competency in a way that can be felt by other people. That it's less about your values and more about the actions, about the processes, about thinking about what that person's experience in your cultural competency actually feels like. Yeah.
We have a tremendous number of thank yous, great jobs. This is powerful. Thank you, Jody Ann. Exceptional, just visualization and support. Yes, we will get a checklist out. Yes, thank you for the reminders. Such incredible, just here's how to do it, how to approach it, how to be tactical. This is how you change processes. So we will absolutely share that with everyone. We'll post it as part of the resources. Folks are chatting in and saying they watched your wonderful TEDx talk that is posted on our networking cafe of why you should not bring your authentic work to self. Do you maybe want to just chat a few minutes about a little bit about kind of the genesis of that talk and kind of the culmination of the feedback of that talk?
Yeah, for sure. So for me, I like to break down this jargon around diversity, equity, inclusion, and think about, okay, what does it actually mean if we took the jargon out? And so one of the like jargon terms that I have been thinking about was this kind of call to action of bringing your full authentic self to work. And as for me, someone who has been in predominantly white institutions since I was in the 6th grade, so how old are you, like 11 years old? Um, you kind of get into this kind of strategy and coping behavior of code switching, right? Like that you create multiple selves to survive in hostile environments, right? And so when I then many years later enter the workforce and they're just like, bring your authentic self to work, I'm like, well, which self, right? I have multiple selves, right? We all have multiple selves, but I think for people who have identities that are underrepresented or undervalued or marginalized at work, there's this other layer of who we have to be, because in our personal experience or in our collective experience, there's risk for our authenticity, right?
Yep. Yes.
If I
Yes.
tell you about my same sex partner, right? We were talking earlier about the pandemic and remote work and having children walk into rooms and all of that.
Right.
For most of our work history, professional history in the United States, for women to have young children was a risk to her career opportunities,
Mhm.
right? So, what self do you want? And what I had found in my career, because I've been in so many different industries. I call myself a classic millennial in that I think I'm on like my eighth career. I think for anyone who graduated during the recession, you're always trying to like, what is going on, right? Like there's just the workforce can be fragile sometimes. But I've been in so many different spaces and I have the experience of, oh, well, this company, you know, sharing my pushing back on something, right,
Mm.
has a lot of space. And in other places, it doesn't have a lot of space. And then when my authentic work style is to ask a lot of questions, is to kind of push back, is to kind of do a temperature check on the group think, and to be Black and a woman and have an afro, it's like, whoa, you're too assertive, you're aggressive, you're opinionated, all of these very racist and gendered
Mhm.
um, kind of evaluations of my behavior. But if I see my other colleagues who don't hold those identities doing those same behaviors, it's like, Jim is such a leader, So I'm just like, wait. Why is that okay for Jim, but it's not okay for me? You say
Yeah.
you want my authenticity, so I shared it. I shared that part of me with you and
Absolutely.
got reprimanded for it. And so what I wanted to do with the TED Talk is to speak to the myth of that you want me to be authentic in an inauthentic environment because you say you value diversity, but there's nothing about your process or your culture that rewards that diversity.
I mentioned this earlier that you have this incredible visceral visualizing when you speak, that you don't even need slide decks, right? So for those that have not had an opportunity to watch the TED Talk, I would offer that you listen to Jodi Ann's TED Talk because she gives you and places you into the experience of what multiple selves actually means. And, as a Chinese woman that had a career in telecom years ago, showing up in predominantly white male boardrooms, um, I don't I don't have the words that you have to explain that, what it means to feel like a minority. But you do a beautiful job so that those of us that have had to um, assimilate to a workplace culture. And so I'm going to take race out of this particular conversation, just simply say anyone that has had to understand the culture of their workplace and toe the line of that workplace, be in the box of that workplace. When you listen to Jodi Ann's TED Talk, it's very clear. And then for those that are not aware of specifically what it feels like to be in the minority, this is also a great impact experience as a third party to say, oh, wow, I know exactly what
Hmm.
that would feel like in this type of environment. And I'm not gonna spoil it because
We
it's
won't
such a
say it
good
yet.
visual. It's such a good visual that just watch the TED Talk, and about as close as I have experienced without it feeling like a lecture. That it
Mhm.
literally is putting you in a minority experience, and just the betrayal, the
I
betrayal.
know.
It
Like,
is
how, why would you do that? That's so messed
no,
up.
it is, but you graft it so beautifully. You craft it so beautifully that people can absolutely understand a toxic workplace culture, what it feels like to be a minority, and so forth.
Yeah.
We have an excellent question here that says, how do we celebrate heritage well and not awkwardly? How do we do that in our workplace culture? So it's not yet one more bring this dish of food. How do we do that? How do we celebrate it well, but not awkwardly? Heritage.
That's a really fantastic question because we want to celebrate heritage, and that it's, if there's food involved, please sign me up. I'm here to celebrate the heritage all day, right? But what makes it awkward is when the celebration of the heritage doesn't align with the treatment of the heritage,
Mm, mm,
right? So it's not that celebrating the heritage is awkward. It's that after that celebration is over, right? After AAPI celebration month, heritage month is over, after Black History Month is over, after Ramadan is over, after all these things are over,
yes.
the baseline for a lot of people is toxicity, hyper invisibility,
Mm,
microaggressions, underrepresentation, uh,
mhm,
tokenization, all of that. And so I'm not saying don't celebrate the heritage, but let that celebration and appreciation and the value of that sustain. And so for me as a Black person, as someone who's Jamaican, I don't necessarily want to be celebrated. I would like to be respected, right? I would like to have transparency about pay equity and promotion rates. I would like to know where my organization stands and what work they're doing around these issues to ensure that I don't have to spend my professional life dealing with all this race stuff or dealing with all this bias and discrimination stuff, that I have a lot of space to
mhm,
excel in my expertise, you know?
mhm, mhm.
And so then when that's the baseline, bring on the celebrations, right? Right. So when people celebrate, they're celebrating work, right? They're normally like, this is, look at what we've done, look at what has happened. And I think that to have the celebration in absence of the history or in absence of context or in absence of valuing and respect, then your celebrations will always be awkward. And if your celebrations are awkward, at least let the food be good.
Well, you know what I was just thinking as you were saying that? I'm like, it's awkward because we asked the people that we're celebrating to plan the party.
That's not celebration. You want to celebrate me? Let me stay home. No.
No, but such
Well,
salient
yeah.
points, right? Yeah, yeah, please, please.
Well, it's like, so as much as sometimes we can feel hyper invisible,
Mhm.
there's also this level of hyper visibility, right? And so like Black History Month or AAPI month comes along and they're just like, Jody Ann, Sunny, can you do something? What are we gonna do to celebrate you? And it's just like, whoa, 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 whoa. Right? That's, now you see me, but you're only seeing me for this identity, right? I talked to a company once, and um as there's just been this racial reckoning, they have a lot of employees of color who have been, they've had a lot of opportunity for visibility within the organization, right?
Mm,
To do speaking things, to lead meetings or initiatives. And visibility is so important within a company and within an organization because the social capital, the opportunities, and all of that can
Yes.
come with it, right? So I'm talking to this guy, and he's like, anytime there's like some type of cultural initiative, they're always calling me, right? And he's like grateful for the spotlight, right? And it's also deserved, right? Because this person has expertise or is doing work in it, whatever. But let's just say there's like a engineering conference or something that's related to the actual function of his job. He doesn't get called.
Yep.
So it's like what makes it awkward is when you only want to celebrate my culture, right? Or what you think my culture is, because a lot of times people get misidentified in these processes, these dynamics, or you misidentify or misread that I want to celebrate my culture here, right? I don't necessarily want to do the celebration at work, right? So there's a lot that's going on, but what about when there's an HR conference? What about when there's something that's like in the function of my work? Do I also get opportunities for that? And it's not either or,
Right.
it's both. And so that's what I'm saying. Like, I'm not saying don't do the heritage celebrations or the acknowledgments or whatever your process is, but how do you make that true all the time? That I feel valued and respected and celebrated, that I want to invite my colleagues to have these conversations, right? Where we can be collaboratively in community and on this initiative to put on this event or, whatever your celebration programs are. And that I feel comfortable with these people, you know, and safe to have those conversations. And I don't feel put on the spot or that I have to speak for a whole community when on this one day, this whole
Right.
year. So yeah. And not to only make these acknowledgments about like the violence that our community faces. There's so much more to our cultures. Like there's so much texture, there's so much nuance. Um, and so I think just bringing more intentionality on what these celebrations or these initiatives look like and trying to find the evidence for the value for these communities throughout the year. Then it'll be less awkward.
I think it's incredible as we ask folks to comment on being a representative of a whole, but then continuing to see the individual and promoting the individual through all the multifaceted skills and areas of interest. Just as we look at patients are not just patients, but they also come with their own individuality, so do we need to honor that one-to-one with our staff, that one-to-one with our patients, and that one-to-one with our stakeholders within the community.
Mm-hmm.
You've given us so much, and I took a heavy breath there only because I was being transported right back to all of these different interactions. And then, also taking a breath and really carefully reflecting on, as an employer myself, how are we doing that within our workplace? Where can we improve? Where have there been, biases that lend to making a decision on who should lead a project or interact with a particular stakeholder? And I think that self-awareness only can come with this thoughtfulness, this moment to pause, and this education. So thank you for being our public health expert, our voice to help visualize all of the different types of experiences that you yourself have shared, but then given voice to those that were not able to speak today, but that we've learned and gleaned and heard because you've given such great voice to them. I'm going to just read two comments that I feel like really culminate the impact of your speech to us today. Really, your conversation, not speech. That we're having a dialogue. We're having this conversation. The first comment is, Jody, as a person of color myself, I'm so grateful for your wisdom and grace here today. You have shared so much truth in a way that can be clearly heard. Thank you.
Thank you.
And the second comment is, thank you. I love how you put the solution back on the majority to create the solutions. And we are part of the majority, right? Systems won't change if we who are part of the system don't put forth that change.
Thank you so much.
My new best friend, thank you, thank you, thank you.
Bestie.
Any last, not last, but any imparting wisdoms or further insights to share with us before we close for today?
Yeah, I'll say again, I don't know everyone who's on the call, but I trust that you're doing great work for people, right? And all of this is about how can I do like better work for more people, right? We are always trying to skill up in our work and finding our blind spots and finding the things that maybe we weren't aware of, or maybe things that we took for granted, or things that were uncomfortable for us, or things that we are too exhausted to engage, right? But it's such a fundamental part of who we are professionally and the work that you're doing. And the same way that I did not know anything about dead naming, there are a lot of things that I'm not exposed to, and there are things that I am exposed to that I choose. I don't do the work that I need to do, right? It's not for me to beat up on myself. It's not for me to beat up on anyone here, right? This is how we keep each other accountable to doing this work and to pushing it forward.
Ms. Jody Anbury, you are amazing. Thank you so much for your time. Thank you for all the work that you've done and what you will continue to put forth out in the space. We eagerly await your new book, and we recommend everybody to watch the TED Talk that is on the Networking Cafe, that you will know, again, no spoilers, that you will have the experience of understanding what it is like to have shared experience on not being able to bring your authentic self to work. So thank you, thank you, thank you.
Thank you.
We are now going to take a 30-minute break. Please join us on the Networking Cafe, and then we will come back together again at 2 o'clock, where Dr. Gabe Villas from the Los Angeles School is going to share with us Back to the Future, understanding how your mentoring lineage affects your application of DE&I today to increase cultural competency. Ms. Jody Anbury, my new friend, thank you, thank you, thank you.
Thank you. Thank you so much, everyone.
Take care.